High blood pressure is a common condition that affects the body's arteries. It's also called hypertension. If you have high blood pressure, the force of the blood pushing against the artery walls is consistently too high. The heart has to work harder to pump blood. Normal blood pressure. Blood pressure is lower than 120/80ths of a millimeter Hg. Elevated blood pressure. The top number ranges from 120 to 129 mm Hg and the bottom number is below, not above, 80 mm Hg. Stage 1 hypertension. The top number ranges from 130 to 139 mm Hg or the bottom number is between 80 and 89 mm Hg. Stage 2 hypertension. The top number is 140 mm Hg or higher or the bottom number is 90 mm Hg or higher. A few people with high blood pressure may have headaches, shortness of breath, nosebleeds. High blood pressure has many risk factors, including age. The risk of high blood pressure increases with age. Until about age 64, high blood pressure is more common in men. Women are more likely to develop high blood pressure after age 65. Race. High blood pressure is particularly common among black people. It develops at an earlier age in black people than it does in white people. Family history. You're more likely to develop high blood pressure if you have a parent or sibling with the condition. Obesity or being overweight. Excess weight causes changes in the blood vessels, the kidneys and other parts of the body. These changes often increase blood pressure. Being overweight or having obesity also raises the risk of heart disease and its risk factors, such as high cholesterol. Lack of exercise. Not exercising can cause weight gain. People who are inactive also tend to have higher heart rates. Tobacco use or vaping. Smoking, chewing tobacco or vaping immediately raises blood pressure for a short while. Tobacco smoking injures blood vessel walls and speeds up the process of hardening of the arteries. If you smoke, ask your care provider for strategies to help you quit. Too much salt. A lot of salt, also called sodium, in the body can cause the body to retain fluid. This increases blood pressure. Low potassium levels. Potassium helps balance the amount of salt in the body's cells. A proper balance of potassium is important for good heart health. Low potassium levels may be due to a lack of potassium in the diet or certain health conditions, including dehydration. Drinking too much alcohol. Alcohol use has been linked with increased blood pressure, particularly in men. Stress. High levels of stress can lead to a temporary increase in blood pressure. Stress-related habits such as eating more, using tobacco or drinking alcohol can lead to further increases in blood pressure. Certain chronic conditions. Kidney disease, diabetes and sleep apnea are some of the conditions that can lead to high blood pressure. Uncontrolled high blood pressure can lead to complications including heart attack or stroke. Hardening and thickening of the arteries due to high blood pressure or other factors can lead to a heart attack, stroke or other complications. Aneurysm. Increased blood pressure can cause a blood vessel to weaken and bulge, forming an aneurysm. If an aneurysm ruptures, it can be life-threatening. Heart failure. When you have high blood pressure, the heart has to work harder to pump blood. The strain causes the walls of the heart's pumping chamber to thicken. This condition is called left ventricular hypertrophy. Eventually, the heart can't pump enough blood to meet the body's needs, causing heart failure. Kidney problems. High blood pressure can cause the blood vessels in the kidneys to become narrow or weak. This can lead to kidney damage. Eye problems. Increased blood pressure can cause thickened, narrowed or torn blood vessels in the eyes. This can result in vision loss. Metabolic syndrome. This syndrome is a group of disorders of the body's metabolism. It involves the irregular breakdown of sugar, also called glucose. These conditions make you more likely to develop diabetes, heart disease and stroke. Changes with memory or understanding. Uncontrolled high blood pressure may affect the ability to think, remember and learn. Dementia. Narrowed or blocked arteries can limit blood flow to the brain. Practice healthy living habits to help prevent high blood pressure. Eat a healthy diet. Choose healthy meal and snack options to help you avoid high blood pressure and its complications. Keep yourself at a healthy weight. Be physically active. Do not smoke. Limit how much alcohol you drink. Get enough sleep. For more interesting videos, watch my YouTube channel.